I guess I'm not afraid to talk up on this because I do think tragedies happen every year. When they happen, we as a society get all interested in them, and it becomes a very almost like a voyeuristic experience that lasts about 10 minutes, and then it fades into the distance, and then a few months later, it happens again, and it happens again and again. There was a great tragedy that happened in Texas, I believe it was this past year, where a plastic surgeon actually operated on his wife, but his wife sort of felt a little too comfortable, I think, around the office and mixed her own solution that included local anesthetic. She had a heart attack and died on the table. They had three children. He went to jail. So think about that. Mom's passed away, dad's in jail. Tragedy. Every year, someone goes to Mexico or the Dominican Republic or Turkey or some of these other popularized destination locations for which, you can find a Reddit or a Facebook subpage discussing the specifics about that trip and, what airline to fly into for what surgeon, et cetera, et cetera. And every year, somebody loses their life for that. And the number of cases of complication, we really have very poor accounting for. But I can just tell you, as someone in a metropolitan area for the first couple of years of practice, taking a lot of call, I saw many, hey, we flew to Miami and now we're back and my surgeon's there and I'm here. And it might not be a devastating catastrophic complication, but something that requires the intervention of a plastic surgeon. Creates a very difficult relationship that then must be established amidst a problem instead of before and possibly having prevented that problem happening. So, I would just say, medical tourism, it's taking great risk, and sometimes that risk isn't going to be worth it. I would say, if it's not something that you would recommend someday to your child, then why would you do it yourself?
Hey, everybody, this is Dr. Caleb Steffen, and I'm your host of Coast to Coast Plastic Surgery, and we're here today with Dr. Chris Day. Welcome,
Hi.
sir. How are you?
Hi. Thanks for having me. It's nice to be here.
It's so good to have you on. Chris and I go way back, don't we?
Yeah, we were trainees together, and now we're in practice and stay in touch a lot.
Yeah. Of course, it goes back a little farther than that, doesn't it? In terms of interview trail and all those kinds of things, right?
Yeah. It's really all the steps of the journey, really.
Absolutely. Well, tell us a little bit about yourself, who you are, where you're from, all of that sort of thing.
Okay. So my name is Dr. Chris Day. I'm from a small town, 6 stoplight town in southeast Iowa. I've been really across the country in various training through my education and my clinical experiences. Settled here with my wife and three kids in the Seattle area. And I have a plastic and reconstructive practice called Pacific Sound Plastic Surgery. We do aesthetic and reconstructive procedures for really people of all ages of the face, breast, and the body.
Awesome. So tell us a little bit, for those who don't know, what the what the training process is like, and what that was about in your journey.
So training for plastic surgery is a marathon. In the United States, we go to college before we go to medical school. Each of those are about 4 years. I did a second degree in college, so it was 5. I did an additional pathology program in medical school, so that was also 5. So
you're saying even before, like by the time, just to go from high school to doctor, if you don't, could be 8 or 10 years before you even get there. Is that right?
Right. There's certain accelerated programs where you can go out of high school and do this in about 6 years, but the vast majority of people are doing this in around 8 years. And then that's when we really start our like skill set specific clinical training that we're actually going to use day to day. I don't use a lot of my philosophy degree on a daily basis, I don't think, or my, cell biology or math minors. But, we go into then our clinical training. So that for me was general surgery, which is a 5 year program, and then plastic surgery, which is a 3 year program after that, and then a 1 year craniofacial fellowship. So, yeah, all told for me after high school is about 17 years to become a plastic surgeon.
That's quite the long haul. So basically, your entire youth is more or less spent uh, with you working on being a plastic surgeon.
Feels more and more like that every day, Caleb, Steffen.
That's pretty funny. Well, tell us a little bit about your family, and I know you have some kids, and I know your wife and your children, and so
Mhm. Yeah.
what are they
So,
what are they up to? What's your family life like?
yeah. Well, right now my wife's revisiting back home where we're from. She's with my sister on a trip. I have three children. My oldest is named Sophie, who just got an award at school today for being a good citizen. My middle child is Cameron, and he's in basketball, as is my younger one, Luke. And yeah, we're just juggling them while mom's away.
Yeah. So right now you're the ultimate taxi service, but even when you're together, it's here, there, and everywhere, I guess.
Yeah, I mean, basically, I juggle my practice and the care of my patients with my family, and then try to mix in some, personal stuff, exercise, and everything else. Those are the three things that I just revolve between all the time.
So not everybody knows what it's like to live in a six stoplight town. Is that literally how
Yeah.
many stoplights are in your town?
I think we got like eight now, but
Eight
yeah,
now.
when I was growing up, it was six. Yeah.
Uh-huh. So it probably had a kind of a big party to add numbers seven and eight,
Yeah,
maybe.
yeah, it was just a dramatic development. Yeah, no, I mean it's good. I mean, I think my childhood was a blessing. It was the same, kids that went to your 5 year old birthday party as your 15-year-old birthday party, and you ended up, having really this idyllic sort of stable one place. Very different than what I've provided to my family, which has been, moves to multiple places, but then a bigger perspective on the world. But I think that's what seeded a lot of my curiosities too. I really wanted to go out and explore and learn a lot because I was always concerned about what I wasn't getting exposed to being from a
Uh-huh.
small Western town. So education was important to me. Going on to learn as much as I can. I traveled. Since then became interested in going abroad to do educational programs or even like mission work and medically. So, yeah, I think that's where that was seated is just coming from a nice, stable background where I could pursue those things and have the support, but always knowing that there was more out there.
So as I recall, in your house in particular, you had a something of interest to the high school kids that nobody else had, which created some
Mhm.
interesting stories. You remember what I'm
We had
talking
a
about?
pool. We
Well,
had a
okay, I wasn't thinking of the pool. I
well,
was more
well,
thinking, if I remember correctly, you had a tanning bed in your house. Is that right?
oh yeah, yeah, yeah. My mom was
Now
really,
the plastic surgeon with the tanning bed formerly in his house. Secret is out.
yeah, my mom was really big into tanning. I don't endorse it. Personally and professionally, I've never really been one for tanning. But yeah, I mean, the cheerleaders would just show up at my house at random times when it was before homecoming because they were just wanting to use the tanning bed. So, yeah, it was a blessing and a curse, I guess, that way. But yeah, we had a tanning bed. We had a pool. So I was sort of a location for a lot of places, a lot of people to hang out, I guess.
I see. So that must have been pretty distressing to have all the cheerleaders just show up at your house all the time, huh?
It's a tough life. It's a tough life.
So your wife, Mrs. Dr. Day, is also from that town. So how did you all meet and get together?
Yeah, so I remember the small gym. When I was 17, she was 16. Just noticing her sitting at a table at lunch, and I guess the rest is history, so they say. We both have siblings that didn't really go far away from home, but we both had this, I guess, drive or curiosity, like I was saying. And then we traveled together across half the country, and now we travel together across half the country the other way. And along the way, we've had a kid in three different states, and just exploring this experience that's called life, I guess.
Yeah. So how has that been? I mean, when you have that drive and you have the vision of wanting to do something different or be something different, experience new things. How do you think for you as a couple, has that been similar to what you were expecting when you were a young teenager with the tanning bed at your house versus where it's gotten today?
I mean, I didn't have any idea. I didn't have any concept for a lot of the experiences that you encounter along the way. I guess I just, again, just had this curiosity. I was always someone who that would pursue various experiences. So I remember shortly after we met when I was 17, I wanted to, dip my toe into healthcare and get involved. So I tried to become an EMT in our small town. I figured, they needed the help as a small town emergency medicine service. They didn't want a 17-year-old, so I joined the army and became a combat medic and an EMT, and that gave me all sorts of experiences. And then I, drew blood and as a phlebotomist and worked in other capacities in hospitals, and that was kind of my first foray into healthcare. And all of that was just based off of wanting to explore and have that experience and understand if that was, something that I wanted to continue evolving towards. So I think that's all I've ever been able to do is kind of pursue the next experience, pursue the next level of training, pursue the next educational opportunity.
I have a follow up though, in terms of your service in the army is not something that you talk about all the time, and
Uh,
so I would be interested to hear, and I'm sure some others as well. And first of all, thank you again for your service to our country. But do you have some? A lot of people who are listening haven't served, and so do you have any good army stories or basic training stories
uh,
of
uh,
things that were surprising or memorable for you during that time?
Yeah, I love my army time because you're young, you're healthy, you're full of energy, you're athletic, and all it is sort of like a kind of a stimulating playground for all the stuff that you might find fun to do. So that's what it was for me. I joined in high school. I was in the National Guard throughout college and into the first part of medical school. I even participated in the ROTC for a short period of time. At one point, really I had a decision to make on to make that a career or not. But I was concerned that I wouldn't have all my freedom of choice about going into medicine and where I could go to
Hmm.
medical school. So I chose to focus on the civilian, traditional civilian
Hmm.
medical training. But yeah, I mean, it was fun. I National Training Center, guard post duty with a grenade launcher, not loaded, but overnight is sort of an interesting experience that not everybody has had. I didn't really do much compared to some of the people that I trained with and some people that have served. I mean, I didn't get deployed. I did get activated right before my MCAT, which, as you know, is a pretty important test. About 13 days before we were supposed to make it, just supposed to take it, I got a call that was, hey, we're getting activated. And then I went and, did DNA cheek swabs for everybody who was getting deployed. So on one hand, I'm not doing much compared to them. They're going to Afghanistan or something like that. On the other hand, one of the biggest milestone checkpoints in my life is coming up in less than 2 weeks, and I had to go serve. So, I mean, it's yeah, there was always kind of a great benefit to being part of the military, and I'm thankful for the time that I had, but I just knew it wasn't going to be the long-term career for me, but yeah, it was good. It's a great experience.
Tell us a little bit about a typical work week for you. What is the life in a plastic surgeon as a plastic surgeon? What is that like?
Yeah, so I have a private practice. I come in Mondays are our clinic day. Usually that's full day of seeing patients both before and after surgery, as well as new consultations. We do that again actually on Saturday mornings, and as needed and somewhat interspersed between the throughout the week. But on Tuesdays, Wednesdays, Thursdays, and Fridays, I'm usually doing surgery. It varies in surgical location and the size and duration of surgeries, but that's either between our surgical center or the hospital.
So a lot of people, sorry to interrupt. A lot of people have been to the doctor, obviously, and they've had their clinic visit. But in terms of the other experience of things of people who may be watching, tell us a little bit more. Zone in on what is a clinic day? What is that like in terms of seeing clinic or seeing patients? What does that take up the whole day? Or are you just talking? I mean, who all is coming to clinic? What's going on with that?
Yeah, I guess it's easiest to understand is kind of like I tell my coordinator, which is that the purpose of clinic in a surgical practice is really to support the surgeries. So that can involve anything in the journey and the guidance through that journey in plastic surgery. So that's somebody coming in to inquire about something. Some people know or think they know kind of what they want, or they might not know what they want and they want to have suggestions. There then are steps before surgery and the preoperative experience of answering all the questions, discussion about risks of procedures, making sure that everybody's completely informed and has had a chance to get set up for success for surgery. That's setting up their follow-up appointments, giving them their medications, compression garments. If the implants are involved, we do something called virtual surgical planning with some of our facial reconstructions. So that's a whole independent thing on its own. So there's a lot that goes into the preparation for the surgery as well as scheduling the surgery, getting its surgical pre-approvals through insurance, which is the whole thing. Then there's the surgeries itself. And in plastic surgery, they're longer. There's some fields that have shorter procedures. If you take out tonsils or you do a trigger finger release or something like that, some of these are 5-10 minute procedures. In plastic surgery, we could do up to 8-hour surgeries.
So on that, in terms of the duration, when I think of short surgeries, like and some plastic surgeons will do carpal tunnels and things like that, but in terms of compared to say a knee scope or tonsils and tubes, or maybe an appendectomy or gallbladder surgery, those are all surgeries that some of the viewers may be familiar with. But what do you think that says about your colleagues and yourself in terms of thinking about those longer procedures? How does that influence the character of someone who wants to be a plastic surgeon? Do you see some trends in that, or are there some similarities in your colleagues that you know? I mean, we know so many. It's a small world.
Yeah.
We know the same people. We know either have talked to or know well many of the leaders in the field and so forth. What do those longer procedures, those microsurgeries, those intense mommy makeovers or facial rejuvenations, what does that say about our field and our practice?
Yeah, I mean, directly from the duration of surgeries and the things that you have to pursue. I mean, you have to have some level of fitness. You have to have some level of mental focus, capacity for longer duration of time, ambition to do that type of work. I mean, literally, sometimes it's a heavy lift in terms of multiple pounds of tissue that comes off of a patient. I'd
Would
say
that
like
be like weight loss surgeries or skin removals,
yeah,
those
like
sorts of things, or
after
tummy
weight
tucks?
loss surgeries.
Sure.
Yeah, I would say, I don't know what you think, but as I ponder your question, I mean, probably a unifying characteristic that I've seen more in plastic surgeons than anybody else, and in most plastic surgeons, is just some sort of strive for excellence there. And I'm not saying that to be kitschy and corny. I'm saying it's because, if you're going to do this work, you're going to be judged by the result of your work, which is a visual product and that is on the surface of a person. So if you're not sort of obsessing over little details and have a little bit of perfectionist tendencies and a little bit of maybe OCD, then it's not always going to go great. So I
So
think
when I'm reading chapter one of the, Graben Smith or Boad Nahai plastic surgery text, and they are talking about the artistry of plastic surgery, and they're talking about the finishing and the perfectionism, you find that to be not just self-aggrandizement, but you find that as a truism. This is what you have seen and observed both in yourself and colleagues. Is that where you're, I don't want to put words in your mouth. Is that kind of what you're
Uh,
saying?
yeah, I mean, not to say that other surgeons and other doctors aren't possessing some of these qualities, but I mean, sometimes we're having to exercise these for a total, duration of a complete day, and do so maybe ranging from larger scope to smaller scope. And, sometimes we do combination surgeries where you might have a little eyelid lift that's also combined with a body procedure. So that's different levels of technical acuity. Some of the outcomes, for instance, in pinning back ears, differences of a couple millimeters can be noticeable by people. So if you're not thinking on that level of that degree of specificity, then sometimes there's gonna, that can be problematic. So I think it both like attracts that, I want to say, just reflecting on my own, kind of tendencies. I think it both attracts it and then it fosters it once you're there and maybe just magnifies some of those tendencies that people have. But yeah, I would say most of my plastic surgery colleagues have not been those, and I, count myself similar, that are willing to sort of, accept a shortcut or, settle for something that could be a little bit better. At some point, you have to, because I think we all have learned the phrase "perfect is the enemy of good" in surgery, but
Yes.
but you're striving for it, right? Like,
Hmm.
famous Packers coach said, "We're going to strive every day for perfection, knowing full well that we won't achieve it." And that's actually the motto of my practice. That's what I tell all of our employees. So, that seems to me like the thing that is the most like common thing to see in plastic surgeons more so than people in other disciplines. I feel. I don't know. What do you
I,
think?
well, I've found that the training process is very long for plastic surgery, and you know it when you sign up for it. You know what I mean? And you have a mentor or a series of mentors who inspire you to go into it. And I kind of love, I don't know, maybe not the place to go into all the details about why plastic surgery, but we'll talk about it with you here before too long. But the idea is that, being out of training for many years now, it only gets worse in terms of that pursuit of perfection and that knowledge of wanting to make the patient, as one of the greatest satisfactions is not personal recognition of a job well done, but that patients and families also recognize it. And
Mhm.
you don't want to be prideful in terms of taking that in. But sometimes it's nice, for that idea that you're having a job well done, that the patient and the family are so thankful for what you've done for them,
Yeah.
whether it's a cosmetic surgery or reconstructive surgery. And,
Right.
and it's that, and of course, if they're unhappy for some reason, you hate that for them and you want every patient to be happy and to have a really good experience. And so I think it's this cycle of
Right.
perpetual, whether the experience, and of course as you get more mature in your practice, of course the experiences are increasingly more and more positive for surgeon and patient, uh, but it's self-reinforcing. It creates that
Yeah.
drive. I assume you experience the same.
Yeah, I think you phrased it really well. You always have kind of had a good way of digesting stuff in a healthy way because you also can't, you can't just survive off of that sort of extrinsic validation, right? Like it has
Right.
to be also internally driven, and you have to have temperance to some degree with expectations. I mean, the honest reality is not every single thing can be 110%, but you can still keep trying. And the times that you get it, yeah, that recognition is is rewarding to hear. I guess when I get that in clinic, I'm just like Okay, good. That's what I was hoping for. But it's like on
Right.
to the next immediately because you're going for that with everybody, you know? And
Right.
it's the ones, if you ever fall short, that you kind of are obsessing about. And then thankfully, we have a field where usually there are solutions. And that's where it gets interesting. And that's where I think, the mark of a good surgeon is when you can sort of swallow your pride in those moments, acknowledge, deal with, come up with creative solution planning. And that's what plastic surgery is supposed to be, is problem solving. The word plasticos means malleable for people who don't know that. And then find a solution. It's all of that, I guess. Yeah.
Yeah. No, I agree completely. And it's interesting. We were talking a few minutes ago about clinic and the idea that you go from patient to patient and you could be seeing a postoperative breast augmentation in one room and then an abdominoplasty in the other and a full facial rejuvenation with facelift and eyelids and all that. And in my practice, I don't know if you're doing a ton of hand, but so there's a lot of variety in plastic surgery, all because of that malleable principle, all because of that we have that opportunity to help people using principles. We're not just doctors of the heart or the kidneys or bones or things like that, but we use those plasticos principles, those malleable principles to shape form and function, right? I mean,
Yeah,
it's fun.
and more and more, like as I've gotten past the initial stages, I guess, of my career, and I kind of hope that I'm accelerating into like a mid-career. I'm really thankful to have that because psychologically it sort of sets your scope, right? Like it says what we can do, like what the public says that we can do, and what that is really anything from head to toe on the surface of a person, which is a very liberating thing. Because if I was restricted to one part of the body, I wouldn't enjoy the really, I think, fulfilling experience of seeing the similarities between other areas. So, I'll use a cartilage graft on the nose, and I'll use a cartilage graft in some other area, and I'll just have the exact same principles, the exact same sometimes tools, exact same technical maneuvers that I'm using in both places. And we get to see things from that global standpoint, where those principles really are the fundaments that work despite where you are on the body or what type of person it is. And I think that's pretty cool because I don't think everybody gets to see that, even in surgery. I
Yeah.
think I think you're sort of hemmed in through the greater and greater specialization that we have in the world to your little keyhole. We enjoy a very big keyhole, and so we can understand that these principles are more pervasive.
Yeah, that's neat. That's neat. Um, So I think we talked a little bit about, kind of the work week in terms of, how your work week goes. But what some people don't know or may not know is a surgeon is not a cowboy anymore, riding through the Wild West all by himself on a team. So, not everyone you interact with is necessarily a part of your team per se, but they're people that you work with on a regular basis to take care of patients. What's that like? Who does a plastic surgeon work with? Who does Dr. Day work with during the week? What are the
Uh,
players involved?
oh, for sure. I mean, so I have a coordinator in my office. A lot of people
Hmm.
have greater staff complement. We're likely going to grow towards that, but haven't yet. I'll work with surgical techs, nurses, surgical center manager types. We'll have reps that sort of support surgeries, whether they be specific products or specific proprietary, like technical tools. We have then supply people in hospitals that we have to source, like individual unique instruments. And that doesn't even talk about the patients that we're serving, which can be the patients, but then they have spouses, they have various different caregivers. Sometimes then there's social workers, there's insurance approval, there's stuff on the admin side that even spans much more broadly than that. So Yeah, it can be a spectrum. And then I try to engage like this with colleagues because I need to have people that I'm resonating on a similar level with so I can, sort of double check myself and then learn from them and foster membership in this like kind of greater community that we're in so that you continue growing and developing as a surgeon. So yeah, there's lots of people you interact with all the time.
Yeah. So we have kind of a fun experience of regular interaction with you and I and several other of our colleagues. Um, Tell me a little bit more about that. I mean, I don't know if everyone would suppose that that was the case. I think it's kind of neat, and I don't know. I'm thinking if I were a patient and I knew this level of networking were around, I feel like that would be encouraging. Tell folks a little bit about that.
Yeah, I think it should be seen as encouraging because, when you sort of navigate your day to day and you might not run into somebody who's had a similar walk of life, a similar spectrum of education. You might not get the opportunity to sort of elevate because you can use the Cliff Notes version with people who have come through similar walks as you have and get very quickly to a more advanced level of communication. So, like you and I have about a half a dozen guys that we stay in touch with that have over the years, multiple years, bounced off difficult cases, difficult solutions, difficult problems and unique solutions, just nuances, practice management. Like, hey, I haven't encountered this. Have you guys? And that's been really helpful. I do that too, or I try to in my community because some of those things are community specific. So there's at least there are about three surgeons that I keep in a regular connection with. And then there's multiple others that I, very comfortable like reaching out to, and they don't always know the answer, but oftentimes just sounding boarding someone that is very knowledgeable can come up with solutions just through a brainstorming process. And then that sometimes solves things for a patient that you might not otherwise solve. Or in the worst case scenario, you have a network of people that can, if you need a second opinion, you can send them to. So I think the more doctor community there is, the more patient benefit there is. I'm going to a conference next month, and I mean, there's people there that are like really high, in my estimation of like their level of skills. And, having a connection with people like that, you never know when that's going to be beneficial for somebody. So I reach
Yeah,
out
that's
to
cool.
them. Yeah.
Well, I think, personally, I'm very thankful. A lot of our interaction is on a text thread. The idea that we
Yeah.
may have 6, 8 board certified plastic surgeons texting back and forth about a particular issue. Hey, this is what I do. This is what I do. Hey, have you run into this? All those kinds of things. I think one, it's kind of fun, but also, you're getting a high level of input, and there may not be 100% agreement, but sometimes you get 3 different answers to your question. Other times, everybody be like, "That's what I do. That's what I do. That's what I do." And so it's just neat to know. I mean, in our plastic surgery, we obviously allow for a lot of creativity, but it's neat to see how that fleshes out in something in days gone by, which would have not even been possible to have that level of real time communication about important issues, whether they're clinical, like doing patient care, or more administrative to deal with day to day things about being a plastic surgeon.
Yeah, and also, we all have a certain level of personal comfort with each other, so we don't have to waste any time sort of, establishing rapport. It's just like it could happen today. We just get like this straightforward to the point, like big ticket question, and 2 or 3 of us out of a half dozen are going to chime in and be happy to do so to the support of one of our colleagues. And that doesn't always happen too, because it is a long training road. You're not always in the same place. You're not always staying connected, and sometimes I think it's fair to say our duration and intensity of training doesn't always foster connection. Sometimes it becomes a little bit of a bunker mentality where you're just trying to
Mhm.
survive all these hurdles that we're put through. So when we can when we can have authentic human connection, it's a blessing, and you don't take it lightly. I value that text thread. That's like meaningful to me.
Yeah.
So
Yeah, me too. Absolutely.
yeah.
One opportunity that plastic surgeons have, that many other surgeons I feel don't have as many opportunities on this, is to, we've talked about communicating with other surgeons, but is to work with other surgeons. I probably don't get to do that as much as I used to, but I still do it on a somewhat regular basis. What's your experience like in that and working with other specialists during surgery?
Yeah, you don't realize, because you kind of come through a training process that is pairing you up or teaming you up with other surgeons all the time, and it's different levels, and it's actually really good because it cross pollinates, and it's sort of like it's not a huge jump; it's like a series of smaller jumps to interact in that way. And then all of a sudden, yeah, you're more on your island, and then also there's some dynamics that just get enforced by what plastic surgery is, and it's kind of business market based dynamics that sometimes perpetuate like siloing and staying on an island and not interacting intentionally, because it can be counterproductive to finances. Um, so yeah, I mean, there's certainly less opportunities to work together with other surgeons. That's why like the before and after communication is higher yield, I think. I have operated with other surgeons on a few, many occasions, but not a whole lot of frequency. But when you're doing a reconstruction after somebody has taken out a cancer, a tumor, um, I've
Like for breast cancer in particular, or are you also thinking head and
breast
neck
cancer,
cancer?
skin cancer.
Sure.
Yeah. If you're going to, for instance, if I do something to the jaw and it might overlap with something with the teeth, and I have general awareness and can appreciate the important things with teeth, but certainly not to the degree of someone who's gone through dental school, then that might be an overlap. So yeah, it does happen, but it doesn't naturally happen with nearly as much regularity as when you're kind of like developing these skills and having cross pollination and crossover in like a university setting, for instance.
Hmm.
But
As
it's
I
good
think back,
to have it.
yeah, go ahead.
Well, it's good when you can have it. And the other thing I was going to say is just like when we communicate about surgeries, um, we do have thousands of surgical experiences now under our belts,
Right.
so we don't necessarily need to be in that trainee mentality environment, spectrum of practice, because we can refer to we all kind of know what the textbook answers are, and we can refer to that and have that as a reference to then delve immediately into the deeper like kind of nuances of a certain situation. So that's almost like in my mind, close to like operating with each other, because
Right.
the movement of your hand and the placement of a scalpel is at some point, once you've done it enough, uh, I think significantly secondary to judgments and decision making,
Yeah.
and weighing possible risk benefits. Those are the more advanced things.
Absolutely. As I think back on our training, especially training together, some of the favorite things that I think about are how we got to do surgery together. Sometimes
Yeah.
as board certified general surgeons training in plastic surgery, we got to do a lot of cases together, you and I and the other surgeons we worked with who were in training and so forth. Do you have any particular experiences, positive experiences with that stand out as like this was a favorite case or a fun sort of case to do together, or things that you think about fondly looking back on some of that? Training is
Oh, of
arduous.
course.
So obviously
Yeah.
there's a lot of
Yeah.
drudgery and other things that go with it, but
Yeah. Oh, of course. I mean, we sang a bunch in surgery.
I guess people wouldn't
Um,
know that, would they?
yeah. I remember many times Dr. Caleb Steffen was just like this calming force in an operating room where maybe somebody had just come in with some massive facial trauma and it's off hours when it happened and the staff just worked their 12-hour shift and people are stressed and the surgery's hours and hours long and Caleb would just say something like all righty then, how's everybody? And it'd just be like, oh, this guy's Teflon, this guy's just cool hand Jake all the time. So I wasn't the only one to recognize that. Like our junior trainees would come in and be like, yeah, and then Doctor, whoever, like angry man, was saying something to us, and then Caleb was just like, okay, all right. So yeah, I have lots of memories like that. No, it's an intense pressure cooker. Sometimes, when you're operating on, a delicate structure in the back of a baby's throat that is going to determine whether or not they can swallow or speak later in life. That's an intense pressure cooker scenario.
Cleft
That
palate, right?
Yeah,
Yeah.
yeah, and that you know how many of those have we both just endured and had a potent, like, you know deep-seated memories for experiencing again and again and again, dozens and hundreds, and can't you really can't almost put your finger on the intuition that is sort of driven home by that crucible experience, that even the field itself, I don't think, can always articulate the educational value and details of all the time to great specificity, but we all sort of have this sense about us that is driven into us over time. So yeah, I don't know. There's too many, senior
Yeah.
residents who knew a mandible fracture was coming in and said, "Hey, go take care of this, guys, and let me know when it's done."
We took
The
care of some of those, didn't we?
we took care of multiple of those, or the hey, how many hours have we been waiting for the ENT to be done with the resection so that we can put the whatever back together? Hey, I heard it, they were ready. Oh, do you hear they were ready? I'm gonna go check to see if they're ready. Like
Uh-huh.
that was just normal week, all the time. Yeah.
Yeah, I remember I remember about it, and I remember with some fondness of engaging on a high level, and I know you did too, with the drama that is complex care in a level one trauma center, where
Mhm.
where we trained at the University of Tennessee. It was a literal and geographic intersection of many metropolitan areas all at once, and so we would
and
get
wi- and
done.
without a certain threshold that was met to make for multi-specialty coverage all the time. So as the plastic surgeons who were this broad scope, sometimes we were at the ENT and the OMFS and the orthopod and lots of things all at once. Yeah.
That's right. And so we would get done with maybe a day of facelifts and breast augmentations and tummy tucks. And then at the end, when we were done with all that, check in with the team. And now it's time to take care of the lady who got her, a guy who blew his face off, or a lady who got, a chainsaw to the face, or maybe a couple of fingers and
Mhm.
cut off or something like that. Go take care of that. And then call it an evening, maybe after we finished all that, right?
Yeah. All the while having, an attending cadre just telling stories about how much tougher they had it, and how much more they did back in the day. So yeah, that was the experience. Yeah.
Of course, it's interesting now being farther along in practice, thinking about how, when I think of today's trainees, thinking,
Yeah.
like some of those same sorts of thoughts are like, oh, you guys are soft, I mean, the
Mhm.
perspective is interesting, as we go along, for
Yeah, I
sure.
have a friend. I have a friend from general surgery. I very clearly remember him and I in the pediatric surgery call room on our first day of intern year, just asking like what our logins were, And he ended up also doing some time in university settings. And he just basically said, like, Chris, remember when, like, the only thing that mattered was whether we got the work done and whether our attendings were pleased with us or not. Like, that's not like that at all now. Like, my residents, if I don't cater to them, then like they're not happy, and it's just completely reversed. And so, yeah, I don't know how much, sometimes you overstate things because you're kind of coping with different phases, maybe. I don't know, but
Right.
I mean, I've heard too many of those stories, and I've experienced too much of it myself personally to
Right.
completely ignore it. Such that I think there's probably, a solid chunk of truth. So, yeah, but I mean, there's no, you know, there's just the next thing and the next thing and the next thing. Life goes on, and there's all these different chapters of it, and it's so much bigger. But at that time, the walls of Erlanger Medical Center are like the universe, and yeah,
Hmm.
you're just in it. Yeah.
Yeah. It calls to mind one of my old mentors. His saying was, "What's true in life is true in surgery," and I suppose he was right.
Yeah.
I suppose he was right. Well, we've talked a little bit about your practice, and we've talked a little bit about the drive to go do what you do. But there's a little bit of a difference between driving towards the next thing or thinking about that and actually honing in on, okay, medicine, okay, plastic surgery. Obviously, big
Mm,
challenges at
mm.
the time that you were going into those, but how does the mindset look? What are you thinking about when you're making that transition? Or
Transition
when you're
from,
transitioning from college to med school and then med school
yeah.
to general surgery and general surgery to plastic surgery, what fuels the drive for the next thing, or what inspired you to pick what you picked?
Well, and it's still ongoing today. I mean, I encounter some things today, as we all do as surgeons, that I have to continue learning and evolving to meet those challenges or to get better and better outcomes, or less and less complications, or just more favorable, pleasing result for. So, I think you have to be someone, one, first of all, that's going to embrace that, and so that there's a certain degree of humility in that. There's a certain degree of commitment and intellect and curiosity that has to go into that, like soup that leads to that product. But I mean, my mom likes to say that I was saying I wanted to be a doctor since the age of 3. I think that was more like people asking me what I wanted to be, and do you want to be a
Mm-hmm.
doctor? Also, the other things. But it was really, like I said, in probably high school and college age, that I started doing a bunch of things in healthcare, volunteering in hospitals, um, and then talking to physicians. I remember meeting a neurosurgeon when I was doing a research project in college. And, this was a guy who was a board certified neurosurgeon, and also one that it was enjoying enough success that he could afford to invest time in research, which we know to be pretty up there. And he came to my neuroscience association, which I was the president of, but I was basically only president of because I was like organizing things and sending the emails. And then here's this neurosurgeon that's like coming and showing up and giving a talk for me and our group. So those experiences are memorable. They resonate. They sort of reinforce and encourage further exploration. But yeah, from so then going in medicine, really what it was, Caleb, is I don't know, you know this a little bit about me, but I had a chance to go into business where I would be much wealthier than I am now. And I don't know, I didn't feel a calling. And I think I felt a calling in medicine. I think it was a question of, like, what is the ultimate product that you want out of your work? And for me, that answer was fulfillment. So that's what medicine to me at the time offered. And then you're in medicine, which is medical school, which is then a whole, much more focused on science, and health oriented applied science, but it could be a completely wide spectrum of what you would end up doing for medical school. I mean, a child psychiatrist versus a pulmonary oncologist versus a surgical ICU doctor are widely different things.
Hmm.
And so that was a realization. I came to a medical school, and then I asked myself, okay, well, what do I like? Well, I was a neuroscience major in college. I like brain function and nerves. I like things that I use my hands for because it's real, it's concrete. To me, it was, it's literally tangible. Things I gravitate, and then I had EMT training experience, so I kind of liked acute things. I think I liked things that were, more intense and in the moment. But what won out for me was just like that immediate uh, stimuli, that immediate result. And so what I did, just serendipitously, was I went on a medical mission to Guatemala, where I participated in cleft palate repairs, cleft lip and palate repairs. And this was actually after I'd interviewed for surgical residency, because I determined that, I wanted to be a surgeon. I wanted to work with my hands. I wanted that, both the instant gratification, but also concreteness of it, because I figured, if you're giving 12 different medications and you've tweaked 3 of them over the course of 6 months, how do you really know which one made a change? At least that's where my brain was.
Mm.
I don't think that's
We we have
really,
a few sayings over that, don't we? Cut to cure, tissue is the issue. Don't let the skin
yeah,
get between you and the diagnosis, and a host of others talking about the definitiveness, right? If that's even a
yeah.
word of surgical treatment, right?
Yeah, and pun intended, but I don't think it is really that cut and dry now. But it seemed much more cut and dry than it other avenues, so it made more sense to me.
Hmm.
And then I went on a cleft lip and palate mission, and it was just, my mind was blown. I'd never been part of anything that was changing lives so dramatically and so positively for life, for these people. These are kids about a year old, and I just really wanted to be part of that. So I was at a medical school that had no plastic surgery program. I then went to a residency that was, because I'd already interviewed for everything, that was not positive on going into plastic surgery. They like to produce intensive care doctors. They did not think there was value in producing plastic surgeons. And I just, I got brave third year. They gave me a list of electives. We only got 2 electives in 5 years. And so you had 2 shots. And the other one was going to be after you chose your fellowship path or career path anyway. So it was really one shot. And they gave me a list of options, and it had everything on it, every specialty on it except plastic surgery.
How about
And
that?
and then I thought, wait a minute. I seem to recall intern year we were training alongside a bunch of plastic surgery trainees. Let's see, I've met some of the attendings since then. That cleft lip and palate thing that I saw, I'd always regret it if I never at least tried to be part of that again. So I'm gonna do that elective, and I did it at great peril, because universities can be very politically charged environments, and if
Mm.
you cross the aisles that are not supposed to be crossed, it can be dangerous. And I did it anyway because I really just I had to explore that, for my own self gratification, and then understanding of whether I could do that work. And so I did, and I'm glad that I did. I'm now an Operation Smile surgeon. I don't get to go nearly as much as I would like, but I am that surgeon that I saw to some degree, a decade before. And that wouldn't be a path that I could have gone down if I didn't have a little bit of courage to do it. and sort of go against the odds and do it because it's what you felt called to. So yeah, that's what I did. That's what I'm still doing. I mean, there's care that I'm asked to do that I'm not really sure if this is what I set out for, or sometimes it's, I'm not totally sure if I can do that. But then with honest self reflection, talking with colleagues, talking with mentors, you explore that beforehand and you figure it out. And I've done many things since being out in practice that I've successfully, executed. So it's not just at the beginning; it's also in the middle and probably all the way up until the end. I would imagine. I don't know yet.
Absolutely. Always learning. And any mature surgeon or professor that we hear, you never stop learning, growing, and that ability to self-reflect and adapt practice to needs and referrals and your patient's needs. I think that's one of the beauties of being a plastic surgeon, is to have that opportunity. And for the listeners who don't know, many people go into plastic surgery to be craniofacial surgeons. They want to do cleft lip and palate surgeries. And so Dr. Day had the rare opportunity to actually become one of those craniofacial surgeons amongst a sea. Of course, there's very few plastic surgeons, but amongst a sea of plastic surgeons who wanted to do that. And he was one of the few who had that opportunity. So pretty neat when you think about it. A dream birthed, it's in some degree since childhood and realized. Pretty neat, pretty special, if you ask me.
Yeah, I consider myself lucky to have. I mean, it's 99% probably other people and maybe 1% me. It's friends and colleagues along the way. My parents were instrumental in supporting me and just kind of giving me the confidence of like, hey, you can do whatever you want to do, and if you don't succeed, you'll be okay. My wife has been with me now for a while, and she's a long-suffering supporter of all the, times when I get stressed out. So, yeah, I mean, it's certainly not without a lot of help, but yeah, I consider it a privilege to be able to do this work and to be able to kind of like come from a little town and first-generation college grad to, be out here in the big city, double board certified, and, doing work that I think is meaningful. So it's a blessing.
That's cool. Well, piggybacking off of that, I think you've kind of summarized a lot of it. What would you say is the best thing about being a plastic surgeon then?
Yeah, it's that, and you're entrusted. You enjoy a privileged place in society where you can help people transform, and you can do it in a few hours. Just like I saw on those cleft missions, these surgeries would be a couple hours, and then they change for 80 years. We do versions of that every week. Like you do. It can be a recovery from a trauma, a recovery from a cancer, a recovery, reclaiming a piece of their body after they've had life happen, weight gain, weight loss, children, just age and time. All these things plastic surgeons can have a profound impact on in the course of a couple few hours, a lot of times. So it's just a privileged place to be able to be.
That's cool. That's cool. And now we'd like to talk a little bit about what is your favorite surgery? What surgery do you like to do the most? That's a hard question for a plastic surgeon, as far as I know. But
yeah,
if you could pick one.
Yeah, it is a hard question because we do so many different things and they can be like vastly different. Rhinoplasty, if I had to pick one, is probably what I would say. It is, it's the most prominent structure in the face, so it really has an impact on someone's appearance, not only of their nose, but of their whole face a lot of times. And it's delicate. Not everybody does it. I think you have to have a certain comfort level. I decided in 1 year of training that I was just going to focus, like when you have to pick a track at a conference or go to certain conferences, I just decided, I'm going to kind of focus on the nose. And also the bony work and training that I did, I think parlays very closely to not only the 1/3 of the nose that is bone, but cartilage, which has, similar structural properties. So that's probably why I gravitate towards it. And, through no probably special talent, maybe luck, or just I don't know, it just happened. It just happens to be the area where I have the least problems. I have the most like kind of satisfaction and the least complications. So that's always nice as a surgeon. So you're not, doing something that doesn't go where you want it to go. It's going where you want it to go. So yeah, I would have to say rhinoplasty probably.
That's kind of neat, and I would say that a lot of people, if they're not plastic surgeons or ENT physicians or other people who have some expertise in rhinoplasty, wouldn't know that your statement that you like rhinoplasty because it is just one of your great strengths don't wouldn't necessarily know that rhinoplasty is considered one of the pinnacles of surgery altogether, one of the most difficult surgeries for a plastic surgeon to do, and something that people really struggle with maybe their whole career in terms of doing something as complex and wonderful as a rhinoplasty. And here you are saying, to the audience, to me, that's just your wheelhouse. I think that's pretty neat.
Well, thanks for the praise, but don't psych me out. It's
Oh,
going.
don't be psyched. Don't be psyched out. As you know, I also love rhinoplasty,
Yeah,
but it's fun to talk about and
yeah.
fun to know that you've spent the time and effort and have the knowledge and expertise not only to do it and to love it, but to do it well. It's very special.
Yeah. Yeah, I think sometimes your skill sets are sort of percolating and developing in ways that you don't even appreciate how they're going to be tested or applied until you're doing them. And I think that's how it worked for me with rhinoplasty. I did nose modification on babies when we did the lip and palate repairs, bony modifications on people who had a mangled face after they kicked by a horse or had
Mm-hmm.
you know, um, a car accident or something, or reconstructing the skull that was congenitally malformed or had the result of trauma and things like this. And then all of a sudden, you're working on these small, delicate structures, these small bones, these cartilages within the nose, and it's sort of like at first in your first few cases I haven't exactly been here by myself before, but you kind of have at the same time.
Mm-hmm.
You've been all those other places, and I think that's a good microcosm story of all of plastic surgery. I mean, we are doing very broad training, very in-depth training, very thorough training, and then all of a sudden, you're honing in, usually at least in the area I am, where everybody wants to know what you kind of specialize in because there's so many providers. You're honing in on something, but you've kind of explored the world, even though you're like going in depth in a small part of it. So um
I think
yeah.
that's sometimes what the community or other surgeons may fail, or other physicians may fail to recognize, is both the breadth and the depth of plastic surgery. They can see the breadth because they know the different things that we do, but not appreciating what 16, 18, 19 years of training, whatever the case may be,
For
how
sure.
broad and how deep the understanding that you have. As one of our professors wisely stated, the plastic surgeon is a surgical anatomist, with
Mhm.
that understanding of what the body is, where it is, and what it does, and how to make a difference on the areas that we're called to do, which is not obviously not everything. We don't pretend to know everything about the body or have plans to do anything with it. But in cases where plasticos, those malleable techniques, are employed, such as the way you use in rhinoplasty, that's what we do, right?
Yeah. Yeah, and I just saw a case by Dean Tarimi
Mm-hmm.
that was just it floored me. He had a post, just like you say, at what we do, he had a post rhinoplasty revision surgery that was a significant complication. Basically, the blood flow to the tip of the nose had been compromised, and it didn't die all the way, causing ulceration. It just really atrophied, and it made these little like prong shaped um, small very like if you saw the person's face you would be drawn to this and only this, and your mind wouldn't really
Mm-hmm.
get past it, and she was going to be limited in her confidence and her ability to engage and interact in the world for the rest of her life. And the surgeries that he did, and so you could see a before and after photo and you'd be like, great job, which we would say as well. but he was taking flaps from the inside of her upper lip and tunneling them through to come into her nose, and doing grafts from ribs, and basically the things that we can appreciate as having, been initiated into that realm. But, also game recognizes game. Like, that's a level that is, I'm not ashamed to say, beyond me. And I can appreciate just the breadth and depth, like you say, of knowledge that it required to be able to do that one nose surgery, when others might just say, "Oh, he's a nose surgeon." They have no idea. They have no idea. Dr. Reinisch was another one that I trained in craniofacial under someone who trained under Dr. Reinisch, who trained under, I believe, Dr. Kawamoto, and that guy, and the development of the superficial temporal fascial flap and coverage over an implant that was, before him, extremely problematic, and now going into the future will probably eventually develop into the gold standard, just because of his comfort level and surgical prowess, uh, delicate technical abilities, so he can solve things that other people can't solve. I had the privilege of getting assigned to, in the Journal of Craniofacial Surgery, the Akira Yamada, who was a Dr. Nagata fellow and is now a leader in the world in ear reconstruction, which is, I think, you say rhinoplasty is hard, and yeah, a lot of people do think rhinoplasty is hard. I'm enjoying a good experience with that, but, complex and complete ear reconstruction really is even a smaller circle of people who are doing that. And this guy, just being exposed to him and his thought process, and he told me a couple stories about Dr. Nagata, and this guy just sounded like a machine, like he rounded on all of his patients primarily, then went and did 6-hour surgeries, and then went and rounded again. I mean, it just, I think those, are inspirational stories that carry you just to a higher level in whatever you're doing. But, that's another thing that gets me excited about plastic surgery. I mean, there's people out there that are magicians, and, we just owe them such appreciation, because what they're doing, is life changing. I get to be part of, like, normal life changing. They're getting to, do things that are just superhuman life changing.
Yeah, well, it's fun. It's fun to have the layers and then the humility to know that there's always someone who knows something that you don't, and you can always learn something from everyone you meet. And I think that's pretty neat. So you're a craniofacial surgeon. You're a rhinoplasty surgeon. Who's eligible? What people can have rhinoplasty? Who in the Seattle area? Who in the United States who's watching your surgery and say, "I relate to Dr. Day. I want to see him." What sorts of patients can have rhinoplasty?
Yeah, anybody who has nasal breathing problems that is related to the structure of their nose, which we find out in consultation, or doesn't like the appearance of their nose for whatever reason, either that it's just how they were born, or something runs in their family, or there's ethnic elements of that, or they had a trauma in the past, or they need reconstruction of after something was removed from it, that's reasonably healthy. We sort through their medical conditions in the consult too. Can have a rhinoplasty. A nose job is 3 or 4 hours, most commonly. And most reasonably healthy people can have a 3 or 4 hour surgery. So yeah, anybody, mostly it's nasal breathing or appearance based.
Okay. All right. So there's always risks in surgery. The public sometimes wants magic, no pain, no recovery, no incisions, and those sorts of things, but also a dose of realism that needs to come to the table for someone who's seeking to have surgery. So what are some of the risks of rhinoplasty surgery?
Right. True. I don't think there's any surgery that has zero risk. Fortunately, most of our complication rates are low. And then we just try to control the things that we can control. Like, for instance, if you're a smoker, you need to stop smoking, at least in my hands. I had this conversation last week, in order to do a rhinoplasty. Not everybody does that. I do. But the complications that can happen, you can have death of the skin at the tip of the nose. You can have some kind of funny, very unique and sort of scary, but happen extremely rarely, things like septal perforation, which is a hole in the middle part of the nose. If severe enough, that can create what's called a saddle nose, which can be kind of a caved in back of the nose. If you take out too much of what are called the turbinates, you can create this unique condition called open nose syndrome, where you basically feel like you're constantly congested, even though you're not congested at all. It's kind of the opposite. Um, but the more common things are just the more common things in any surgery, which would be damage to area structures, infection, bad scarring, asymmetry. In rhinoplasty, a palpable graft, because we use a lot of cartilage grafts on the inside. But again, I mean, almost everyone has a little bit of nose bleeding for the first day after a rhinoplasty, but like that persistent sort of pathological bleeding is extremely rare. All those complications, fortunately, I've experienced to be very rare. However, as a leading rhinoplasty surgeon in the country, Dr. Gavami recently said in like a video that I was exposed to, the revision rates for rhinoplasty are between 20 and 25%, even in the best of hands. So I think you have to just go into a surgery with eyes wide open and with a surgeon who's going to give you an honest account on the front end so that you can make a good decision about having a surgery. But yeah, I mean, rhinoplasty is pretty well tolerated, pretty low complication rate overall.
Yeah. Well, as we've discussed, you and I both love rhinoplasty, and you mentioned some pretty significant complications, but you also mentioned that those complications are low. So when I think about things, I'm thinking risks and benefits. So we've talked a little bit about the risks. You like this surgery a lot. Surgeries that are plagued with complications are surgeries that you and I both stray away from, or most practical plastic surgeons, because it just gets to be too much of a thorn in the side, it's not pleasant for surgeon or patient. So being risk averse and wanting to avoid those headaches and the patient suffering, we want patients to do well. So there must be, when you're talking risk benefits to a patient that you've selected for rhinoplasty, there must obviously be more to it than just those risks, or you must find those risks to be low enough that it's worth it to do. Tell me about that.
Yeah, I guess one of the things that I probably left out in saying who's a good candidate for it is also just understanding of that and appreciation and acceptance of those risks, and having reasonable expectations. And most of my patients are, fortunately. I think it's because we're in the Pacific Northwest. A lot of people are talking about natural. Everybody wants, natural. They don't want extreme versions really of anything. But having a reasonable impression that you're going to be an improved version of yourself, I think is what you should take into appearance-based, especially elective surgery. Not like, hey, I'm going to transform into this completely different person. If I get somebody who brings in a photo of models and I've had people who have created like sort of a unique, like abstract artistry of themselves. And, some of these things can be helpful to facilitate a conversation, but also, it has to be realistic. It has to be down to earth. Considered the top plastic surgeon and rhinoplasty surgeon in the United States, I heard once say, if you can't imagine having dinner with the person, then you shouldn't operate on them. Like if you couldn't, enjoy being in their presence for like an hour, then you shouldn't do their surgery, because, a patient and a surgeon really at some degree have to be on the same page. Because while these unfortunate and nobody wants complication, least of all the surgeon, for the reasons that you just said, can happen. If they do happen, you need common ground to work through that. And myself, I'm never going to say die, right? Like if I get a complication, that person is moved up to the front of the line in my practice. I see them more often. I do everything I can to help them. I will incorporate the input of other surgeons, and that's my mentality about that. But for a patient, sometimes their confidence is shaken, and they can't traverse that gauntlet as readily. So that really just comes from, I think, good authentic conversation and communication. The saying of if you tell them after the surgery, it's an excuse. If you tell them before the surgery, it's information. So
Absolutely.
that
Why? So
I just try to approach things that way, I
yeah.
guess.
No, that's so good. And when you talk to these rhinoplasty experts or people who do a lot of writing or talking about the topic, they say a lot of those things.
Hmm.
The patient, the surgery time is finite, but the postoperative time is forever. But
Hmm.
rhinoplasty patients are so happy and grateful
Hmm.
after no
Hmm.
surgery. Why is that? Why does it make such a difference? I find in my practice, there's two reasons for that. And I'm guessing that you would say the same thing or have maybe more than that. But I'd be interested to hear why do you find that the rhinoplasty patient is so happy and grateful for the surgery that you've done for them?
Yeah, I wonder if I guess the same ones. We probably will. They breathe better. I have a very low threshold for doing things that help people breathe better, even if it's not that's their main indication. There's some people
Yes.
it's all about nasal breathing. There's some people it's all about the appearance of their nose, and then there's some people it's both. And most people have some degree of both. So I have a very low threshold for doing maneuvers that help them breathe better, such as adjustment of their septum, reduction of their turbinates, putting in grafts that spread open, like the choke points in the breathing in the nose. And doing those things, in addition, I kind of use liberal splinting more so than others that I've heard of. Almost everybody says, "Whoa, I can breathe better." So
Hmm.
that's good because if it's like your nose is plugged all the time, I mean, everybody's worn nose plugs swimming and it's not that pleasant.
Right.
Um, but that could be them every day. And then, we look at ourselves in the mirror like every day. And I
Good
think
or bad, right?
good or bad. And I think even very down to earth, reasonable people, plastic surgery is always subject to this evaluation, because kind of peanut gallery opinion of what's good or bad or should be done or shouldn't be done or if it's bad enough to stress over. But I mean, we don't always choose these things. That could just be seated in the mind of the patient, and a plastic surgeon does operate to some degree on the mind of the patient. So, if they are nagged by and affected every single day, even a little bit of their self confidence by something that is appearance based, then that can impact them. So I think that's the other thing is they might have been dwelling on this for years before they even have the courage to seek a consultation. So
Hmm.
those would be
Yeah.
the two that I've seen.
I, that's it, right? I mean, that's
That's
it.
it.
Yeah,
Yeah.
I mean that's what I think anyway. But I mean it's just it's so apparent when the patient shares. You have to imagine, even though we don't talk about our rhinoplasty patients all the time, it's such an apparent thing that it's analogous to breast reduction. All the reasons why patients are so
Yeah.
happy after those. Their back and their neck and their shoulders feel better, no more rashes, and their breasts look better. So
Yeah.
it's that chapter one plastic surgery, right? The restoration of form and function.
Yeah.
So.
Absolutely.
I think that's pretty neat. Um, uh, if you can, I'd like to add some for people to look at. If you would like, we'd be happy to share some before and afters when the video is done. And so, by
Sure.
all means, if you have release to do that, feel free to share, and
Yeah.
we'd like to share those on the video.
Yep.
And you have, if people want to do their own research, where can they look that up?
Oh, so our website is pacificsoundplasticsurgery.com, pacificsoundplasticsurgery.com. We have some before and afters on there. People can follow us also on Instagram. I try to do basically a bunch of video posts of educational content. We just talked about open versus internal rhinoplasty, for example, this week. And again, Pacific Sound Plastic Surgery is our Instagram handle. And then, our phone number is 425-818-8991. And that's my office number where my coordinator, Sophia, can always put you in touch with me and I can see people in consultation.
What concluding thoughts would you have? What would you like for people who have had the chance to enjoy this? What would you most want them to know about you and your practice?
Yeah, just about me. I feel like I'm a fairly normal human. I don't think that everybody approaches plastic surgeons like that. I mean, it's a conversation. I think the more authentic that it is in a consultation, the better. But yeah, a lot of people wouldn't know that, I'm struggling to get to the next kids event just like they are in the evenings, and get people to where they need to go on time and make sure there's food in the fridge and everything else. And it's a great balance. It's a great problem to have, but we're like you, family man, long married, and good dad. We're just all trying to do a lot of different things, wear a lot of different hats. I enjoy having the blessing of doing that, but also, not infinite resources, and just trying to do the best I can for as many people as I can.
That's cool. We've mentioned it a couple times. How can patients find you?
Yeah, our website, pacificsoundplasticsurgery.com. It has all of our contact information. We have online scheduling. People can literally just click a button and pick whenever they want to come and see us.
Okay. If anybody's audio only, phone number to go with that, Instagram account, anything like that?
Yeah, so 425-818-8991, and you can speak to our coordinator, Sophia, and then Instagram is, again, Pacific Sound Plastic Surgery.
Okay. Dr. Day, thanks so much for your time. Any other closing thoughts?
No, thank you. This was really fun, Caleb, and I'm glad you're doing this. It's good to have a positive voice out there.
Awesome. Thanks, Chris. We'll talk soon, I know.